Okay, so you guys, this one we're going to look at is a very ominous tracing. These are late decelerations, which means utero-placental insufficiency. It means not enough oxygen is being delivered to the baby, and it means there's a buildup of CO2 in the baby, which causes acidosis and can cause brain damage. So this is a very ominous finding. So when we look at the contractions, we can see them here. We see the contractions. And now we're looking at the fetal heart tones related to the contractions. And we can see that the fetal heart tones decrease after the peak of the contraction. So at the peak of the contraction, there was no oxygen or CO2 exchange to the baby. And then the baby had a deceleration in heart rate in response to that lack of oxygen. So you know the baby is limited on reserves, is fatigued, and we can have a serious hypoxic event. So when we look at it, we can tell they're late decelerations because we look at the peak of the contraction and we can see the deceleration started after the peak of the contraction. Again, the deceleration started after the peak of the contraction. One more time, the deceleration started after the peak of the contraction. So our interventions, number one, turn your patient. Number one, turn your patient. Number two, turn off the Pitocin if it's running. We want to stop the insult of hypoxia. When you turn the Pitocin off or you stop the contractions, you stop the stress and you increase oxygenation to your baby. Third, we want to hyperoxygenate her. We want to give her we want to give her a O2 mask with non-rebreather, and turn it on to 10 liters of oxygen to hyperoxygenate the mom. Now we want to increase the pressure to the placental site to push over that oxygen to the gap. So what we're going to do is give her a bolus of fluid to increase her pressure, which would be a volume expander, lactated Riegers. Give her like 500 cc's. So that's going to push over the oxygen faster. And then lastly, we're going to call the provider and let them know what's happening. If this does not repair the problem, there is a potential for a C-section.